Hi, everyone. Thank you for joining today's webinar. My name is Sierra Jones, and I'm the Marketing Coordinator here at Biz Technology Solutions. Reda Chouffani, VP of Development and co-founder of BizTech, will be presenting today's webinar on telehealth. We want to invite you to ask questions throughout the webinar, and you can do so in the chat box here in Teams in the top right of your screen. You may also send your questions during or after the presentation to info@biztechnologysolutions.com, and Reda will answer those at the end of the presentation. At this time, I'm going to go ahead and turn things over to Reda.
Thank you, Sierra. Hello, everybody. Good morning or good afternoon, depending on the time of the day that you're watching this webinar. So today I'll be covering the benefits of telehealth, how you can maximize some of those, as well as discussing some of the risks that come along with it and what you can do to try to reduce and, of course, eliminate them as they come in. Again, my name is Reda Chouffani, VP of Development and co-founder of BizTech. I have spent probably the last 15 plus years working with healthcare organizations. My background is technology and some programming. However, I was very fortunate to spend some of my early years working in medical practices, supporting some of their EMR solutions, billing, interfacing integrations, and that has certainly provided some valuable knowledge around this vertical in healthcare. A little bit about us. We are a technology service provider in the Southeast, predominantly in North and South Carolina. We cover a wide range of services that we help a lot of our healthcare clients with that can range from IT managed services, software development, and of course consulting. And consulting is likely the area where a lot of our telehealth requests are coming in for, just to help a lot of the medical practices see how they can leverage the technology and its capabilities in their practice. So here are some of the realities that we're all facing today. I know that many of you in the healthcare industry are either facing an overload of patients coming in, especially those in hospitals. Some of the clients that we speak with, they have overages as far as, you know, the volume of patients that are coming in, that they can barely have any room for some of the incoming patients, and others have the opposite. And some of that relates to the fact that whether it's surgery, dermatology, and things like that, some practices are obviously not seeing as many patients as they would have had in the past, just due to some of the lockdown where some of the elective surgeries, for example, are not allowed in the state of North Carolina. And of course, any other, visits and things like that that are not deemed urgent and critical would have to be scheduled in the future. But ultimately, what we're facing today is that all non-essential businesses should be closed, and they are likely to be closed for a number of weeks, the upcoming weeks, whether it's up until the end of the month or potentially be extended even further. We still don't know. It really depends, and it's being taken day by day. Obviously, medical practices are seeing a lot of declines in their revenues, ultimately not only from the copays as an example, but also reimbursements. Those will come in at a later time, since filing an insurance claim does take some time, and obviously not seeing patients today will show up in the billing and revenue cycle at a later time. Surgery centers and nursing homes and things like that are finding themselves where they have to reduce some of their staff, whether it's because the low patient volume that they're facing, or simply just being that those revenues are lower, they have to cut down on staff hours just to make sure they can still operate, financially be still stable. Patients, of course, are struggling to find a place to go to get visits, and they don't want to go to a doctor's office and be in the waiting room and potentially risk getting infected or exposed to somebody who may be infected. So we're seeing some patients simply decide to not schedule a follow-up with a physician, and especially at the office. And of course, some of the folks that we're talking to, we're finding out that they are asking for telehealth. And unfortunately, telehealth is not a silver bullet for some of the challenges that all the practices are seeing. Just bluntly, you still have to see patients face to face in some cases where telehealth may not necessarily solve that issue where you don't have physical access to the patient for a physical examination. The reimbursements for telehealth, of course, haven't been fantastic. I know that up until recent weeks, the majority of them were addressing some of the gaps in rural areas. And even though rural areas, there's some coverage and reimbursements by CMS, those reimbursements were not considered, equivalent to some of the face-to-face or the office visits that we have out there. And again, having all of that and including the uncertainty of the lockdowns when some of the businesses are going to get back to, regular business, that's really putting a lot of strain on medical organizations and forcing them to really try to think outside the box and find out how they can still sustain their business during these difficult times and how to leverage technologies like telehealth, obviously, that may potentially offer some relief for some to still continue to see patients. Some of the statistics that I shared here on this slide were just as recent as this past week, and really they highlight some of the concerns that we're seeing in the marketplace in terms of how small businesses are responding to the COVID-19. And it's no surprise that a number of folks that have been surveyed from small businesses throughout the nation outlined that 64% of them have in fact decreased their employee hours. Of course, the decrease in demand, it's seen in the market, whether it's in retail, healthcare, and a number of other verticals. And it is expected to continue to decline. And unfortunately, since really it's very difficult to identify when everything is going to go back to normal, most small businesses are still considering that the decline is going to continue for some time. But ultimately, for a medical practice, there are a number of priorities that they're focused on. Obviously, with their focus on patient care and all the patients that they've seen in the past and still interested in continuing to see, one of the things that they're going to focus on patient care, financial stability, and then, of course, being able to keep physicians and nurses and their staff, safe, especially for those that are still seeing a number of patients at their practice. So one of the first things that we see out there is practices focusing on maintaining patient care. There are a number of medical practices that are seeing patients with chronic illness, and those patients obviously still need to be followed up with and things like that, may still require some prescriptions, whether it's refills or just check in. So being able to still maintain that ongoing relationship with those patients despite the lockdown is something that's high on the priority list. Financial stability. Clearly, right now we're seeing a dip in patient visits, and obviously for some practices more than others. And some of those dips won't necessarily show for some time, obviously due to the fact that most practices now are processing reimbursement checks from insurances for visits that were a month or so ago. So it may not be today where they see the financial dip. It may be a month later or even further down the road. But ultimately, that's still a big concern for medical organizations. Patients and employee safety. Many of the practices that are still open and seeing patients, they're looking for ways to still continue to treat patients without increasing their risks of potential exposure. Whether the patient needs to come in for just a general follow-up or some common illness, that it could be the flu or just a common cold. Ultimately, if there are risks that that patient could potentially be infected with COVID-19, some practices are looking for ways to minimize those risks, even if it means doing an initial e-visit and then doing a follow-up later. And the last one is maybe looking at telehealth for an opportunity to move forward. I know telehealth has been on the radar for a number of medical practices in the past few years, but due to some of the low reimbursements and some of the other challenges that are obstacles in their way to adopt the technology, many have stepped back and still have not fully adopted the platforms that they have access to. But ultimately, now can be the time to actually evaluate some of the options that are available in the marketplace from a telehealth perspective and see how they can be a good fit for your practice and organization. So what can you do to minimize business impact? And is telehealth really one of the answers? And this is something that we want to cover. So as you all know, telehealth means a lot of different things to a lot of different folks. And depending on what kind of practice you are, telehealth could simply mean a means to have an audio or visual conference with your patient where you talk to them about some sort of illness that they have or some concerns that they have. It could be drug interactions concern, or it could be simply following up to see how they're doing with some of the prescribed treatment plans and things like that. But ultimately, in other cases, it could mean that you are doing a telehealth session to follow up with the patient and check on their vitals. One of the pictures on the top right-hand side of the screen highlights an example where you could have a piece of equipment at the patient's home where it is taking blood pressure, oxygen, it could be a number of things, EKG, and the physician or clinician can review some of those results remotely. So that's also another model. Another case could be just general follow-up and basically doing, whether it's for mental health services or just general follow-ups with your patients on questions on a refill or requests for a refill. So what are some of the telehealth benefits? And I know some of these may be common in knowledge for most folks on this call, but let's just rehash through some of them just to get everybody on the same page, especially as we're dealing with the COVID-19 today. So one of the big benefits is the ability to offer remote access to patients. And what I mean by that is connect from anywhere, whether it's the physician connecting with the patient from their homes, or obviously the physician connecting from the practice to their patients who's sitting in their home. Ultimately, telehealth allows us to connect with folks in different areas without the need to have them show up at the facility. And that becomes a key functionality that telehealth offers, where you can still see folks without having them to be in a waiting room and then be checked in by a nurse. Get to those patients that are in most need of follow-ups, with patients that may have a chronic illness and you need to continue to follow up with them and your practice is closed, or you decide that you're going to wait until a few weeks before you reopen. Telehealth is a great option to maintain patient engagement and still communicate with them in terms of how they're doing, how they're following the treatment plan, and things like that. Provide flexibility to patients and providers. This came in on a number of examples that we've seen out there where some physicians want to have some flexibility with their schedules, where they want to work half days and they want to still be able to see patients. Telehealth offers that benefit of that flexibility where a physician can work from home, still visit with patients who are also in their homes or even in a nursing home, and be able to still interact with them and perform some basic examinations. And then, of course, augment the services that the practice has to offer. Especially during a lockdown, your patients that come regularly to your office, whether it's an ENT practice, a dermatology practice, or any practice that regularly sees patients, one of the things that you want to have in your service catalog is e-visits. Because ultimately, you don't want your patients to go to somebody else or another practice simply because they can access their clinical resources via telehealth services. But despite all these benefits, there's still some concerns that a lot of practices have in mind when it comes to telehealth. And these are some of the hidden dangers that we always seem to not necessarily realize up front, but they're real for a lot of folks that really look to adopt telehealth services. The first one being, will the patients use it? Is the technology too complicated for, let's say, some patients to adopt the technology? Depending on your type of specialty, maybe you're seeing a lot of Medicare patients, or maybe you're not. Maybe you're seeing a lot more millennials. Who is going to be able to adopt the technology and leverage it? And who's going to still be asking for a face-to-face visit, even though they just need the general follow-up that they can do over the phone or over video and audio? The reimbursements or the money. Obviously, now that CMS has opened up where telehealth is reimbursable, regardless if you're treating patients in a rural area or not, The big question, it comes down to, is that sustainable? If a lot of your patients move over to telehealth services, are the reimbursements sufficient enough to sustain your business? And these are realities that you have to take into consideration, whether it's looking at your patient volume who are looking to do telehealth and see what that will do to your revenues and your bottom line. Ongoing costs of the technology. Now, again, there are a number of solutions out there that are in the marketplace when it comes down to telehealth. Some of them are free or have, free plans or basic plans. Others are paid, but there's all these other expenses that are related to it. Do you have to increase your internet connectivity to be able to support good telehealth? As you know, you would need faster internet to be able to do video and audio or high quality video. You also need to support any equipment or new hardware that you need to introduce, whether it's equipment you're sending to the patient homes or tablets that the physicians will use from home. These are all considerations that have to be looked at as you're looking at your ongoing telehealth costs. And the last but not least, security and compliance. And this is critical because now you're opening the door to have more communication and more exchange of information, especially protected information, whether the physician or clinician is working from home and making sure that their environment at home is secure and protected, but also the system that the patients are signing into in order to communicate with the clinician. Security has to be planned out, and that starts with the platform of your choice, that ensuring it will be HIPAA compliant and meet all the criteria that are mandated under HIPAA. The other part is, of course, ensuring the equipment that's being used is adequate and is secure as well, ensuring that the devices are encrypted. And these are devices that would be used, let's say, by the patients or the physicians, and all these different things. So ensuring that there are adequate safeguards in terms of the hardware and platforms themselves is critical. So the next slide, we're going to talk about what are some of the options that you have to choose from. And I outlined here 3 different options to choose from, because ultimately you have to make a decision based on your type of practice and the types of services that you're going to perform of which platform and product that you're going to need. We start with number 1. What you're looking at there is a telehealth type of platform that can support remote monitoring of patients. You'll be able to pick this technology if you need to monitor EKG or other vitals, weight, temperature, or any other vitals that you have, oxygen level, blood levels, blood sugar levels, and things like that. So again, if you are treating chronic illnesses and you need to maintain visibility over what these vitals are at a certain frequency, that's a great platform or an option for that. Or if you're a primary care physician or just need a basic telehealth option that offers you the ability to just do general e-visits or electronic visits, that basically think of using FaceTime on some of the Apple products. That's where you start looking at those basic video audio conferencing platforms that technically do offer e-visit capabilities, because ultimately you are connected with the patient via audio and video and talking to them and doing just general examination over the camera. And again, it's very basic. It meets a lot of the requirements of some of the practices. But again, the key there is to make sure that the platform selected is in fact a secure platform that meets some of the HIPAA requirements. The next one and the last one, as you see here, MedPod. And this is a great platform by Henry Schein that it literally comes in a suitcase. Now, you don't necessarily have to have this platform in a suitcase. They have other standalone carts that come with all the equipment necessary. And the nice thing about it is you can purchase some of the add-ons based on your needs. The add-ons could be a stethoscope, a camera for any dermatology examination, and EKG, things like that. So these are all things that you can use if you're looking to have maybe somebody on the other end perform the examination for you while the physician is connected remotely and monitoring the vitals and interacting with the patient. A great use case here would be a nursing home, for example, or assisted living, where some clinical staff at the location or the facility can perform some of these examinations while they're with the patient, while the physician is connected remotely from the practice. So let's talk about options, because ultimately there are a number of options to choose from that are out there available. And we've seen a number of practices talk about, different vendors and products, but we picked a number of ones that we have some experience with, but we also feel like they meet a lot of the requirements and highlighted the pluses and minuses of each one. We start with the MedPod, as I highlighted. That's the one that was shown here in the picture as the third option. As you can see, that one is likely to be a good use case for anybody looking to include sensors as part of their examination and looking to check vitals and things like that in real time during the examination. The next option is DocSeeMe, which is a very creative name. Obviously, when you read it fast, it's DocSeeMe, but it's spelled as you can see there. And that one is a really great entry platform for folks that are looking to start slow, just try to get used to telehealth, be able to communicate with their patients, through audio, video, as well as text. And then, of course, it has a number of other capabilities, as you can see in the list. On-Call Health is also another option that's available in the marketplace. They're a well-known brand, and they have been known for quite some time. One of the things there is they support mainly Apple devices when it comes to remoting into and having the chat or video audio conference, but it is certainly a platform that's very capable. The fourth one, believe it or not, is Microsoft solution. And when we highlighted this solution, we are not talking about a product that Microsoft has designed specifically for healthcare. As a matter of fact, it's actually using the existing products that some of the practices already have. I know a number of practices that we work with, many of them use Office 365, which is the platform that's used for emails and cloud storage and different things. But believe it or not, if you happen to be one of those healthcare organizations that's using Office 365, you are actually sitting on a telehealth platform. You just didn't know that you already have access to it, and you don't even have to pay extra for it. So just saying, if you are one of those practices, and we'll show later on a quick demo of that, you actually do have access to that. And the last one is, of course, FaceTime. We still see folks using it, and obviously the concerns there are security, how to operationalize it. Physicians are using their personal devices, and there's some concerns around security there, but obviously it's still an option for some folks to use. This is some additional details available here, and we're going to have this recording as well, so feel free to go back and review it. These are some of the screenshots of what the platforms look like, and this is what the physician would see remotely when they use something like the MedPod. That's obviously an image that's zoomed in, and as you can see, the quality is incredible. So for dermatology practice, they can actually zoom in and look at a spot or something on the skin, and they can analyze it remotely. They can also take a look on the right-hand side, the stethoscope, the audio. This one is DocSeeMe. Here's an example on the right-hand side with what the web view would look like. And this is from a mobile phone, me as a patient in the waiting room, waiting to see the physician. On the left-hand side, as you can see, is the full browser view. This one is the Microsoft tool set. Casey, in a few minutes, is going to give us a quick demo of it. But as you can see, this is where the patient will go into the website to schedule their appointment or their telehealth. And on the right-hand side, you can see you can have your own questions to ask the patient prior to the appointment. Think of things that you typically ask the patient on the chief complaint or what do you need to come and see us. You're actually putting this out there for the patients to answer electronically. This is the mobile view of the Microsoft Office 365 option. This is just some interactions that you're going to see during the demo here by Casey. This is what the patient is going to see once they prepare to join the telehealth session. So now I'm going to turn it over to Casey Cook, who will do a quick demo of the platform using Office 365. And the intent here is to highlight how many of you who may already have Office 365, you can leverage it today. But please feel free, if you have any questions, to post them and then we can answer them. So Casey, I'll turn it over to you.
Perfect, thank you. All right, so I'm gonna try and switch to sharing my screen. Give me 1 second. Can you see everything okay on your end?
Yes, okay, absolutely.
Perfect. All right, so what I'm gonna run through here is using Office 365 as kind of a platform for telehealth. And I'm gonna try and view it from the side of the patient. Obviously, with your internal team, there's going to be some training that will need to be done. But as far as trying to make that a seamless for the clients, we're trying to make it as seamless as possible for them. So this is just kind of a fake landing page that I created for our demo tenant for the Pleasant Care Medical Center. You can see here we're offering now telehealth checks, and you have a QR code, the link that will bring them directly to that booking site. And so this is what that site will look like. So they click on it, or even from a mobile phone, we can scan that QR code and be brought directly to this site. So this is using Microsoft Bookings, which comes with Office 365. And you can see here we've added a few different services. You can create as many as you need, and then we can limit each service to a specific amount of people. So with each of these, you can see, let's look at this one here. You can see I can have specific staff that are assigned to each different visit. Even with the well check, we're going to have multiple people there. And this is all going to be based off of their calendars as well. So if the patient wants to do kind of a well check visit and they're not really concerned about choosing their provider, you can go to anyone. Otherwise, I can choose a specific one and then view their calendar. And you can see here we have a little calendar where I can choose the date. So this just kind of helps to schedule a time and date that's good for them. And scrolling down, you see we'll have a kind of a little bit of intake information. So name, email, phone number, and this will also allow you to text them. So this will send them a text saying, hey, you just booked this appointment for this date and time. And we can also send text reminders as well as email. Any additional notes that they may want to provide. And as Reda had mentioned, we have a few questions here that we can kind of take a little bit more intake information. Once you fill all those out, you can see down here, I can choose to get booking confirmation and then choose to book it. Once they book that appointment, they'll be taken to this page here where they can actually see, like, okay, I see the date and time that it was scheduled. What I actually scheduled was the well check visit and then which provider I'm being assigned to. Now, if they, let's say need to change that at any point in time, I can actually come in here and cancel that booking or reschedule it, or even do a whole new booking for maybe a different service there. And just to kind of give you an idea of what the text messages are going to look like, I send it for Google Voice here, so you can see it actually will send them a message saying, hey, confirmation for booking with this medical center, and give them a date and time. And this will also send a very similar text message. I think you can set for an hour or maybe the day before, just as a reminder to them. All right, so now I'm going to go over to the email. So they will also get an email. It just kind of shows them the same information that we had saw on the confirmation page and in the text message. But this also is going to give them a link to join a Teams meeting. So obviously, just by clicking that, it'll kind of bring them into that call on that date and time. And I can actually click Manage Booking, which will bring me back to that page to where I can cancel, reschedule, or book a new service or meeting. And I'm not going to click on this just because it's going to open up inside of Teams. But if I copy the hyperlink, I should be able to go over here to a different browser. You'll see it'll kind of give them this option. So I'm just going to choose to open on the web, enter my name, and then join that meeting. So again, fairly seamless where they can just connect directly into that. You'll see right now it actually says someone will let you in. This just means I'm sitting in that lobby waiting for the provider to join that call, and then they can pull me into the call. So again, very simple solution. Again, there's not a whole lot that's involved. They don't require a Microsoft Teams license or any Office 365. They literally are just going to go to this link to join that meeting as a guest user, essentially. All right, Reda, I'm going to turn it back over to you.
Perfect. Thank you, Casey. And again, as Casey mentioned, the intent of this quick demo is to highlight for any of the folks, and we find that quite a few practices already have this platform for their email, Office 365, that the platform actually does have many capabilities that will support some of the telehealth services that are needed. But ultimately, some of the other products that we highlighted earlier, DocSeeMe, On-Call Health, and of course, the one from Henry Schein, are also very capable to perform some of the telehealth services that practices are considering. If you are interested in looking at either to test drive any of the platforms that we highlighted earlier in one of the earlier slides, please don't hesitate. Between myself and Casey, we have been working and assisting some of our healthcare clients around deciding really which solution that may be the best fit for them. And in some cases, it's just as simple as answering questions and concerns that they may have, or addressing some of the potential security concerns that they have by either implementing certain tools that can manage the devices, or making sure that the security settings and configurations are implemented correctly to ensure that the information that's being exchanged with the patient is in fact secure. And again, you can start off with either sending us an email to info@biztechnologysolutions.com or calling our main line and just asking to speak to one of our team members, customer success team members, in terms around telehealth questions or needs that you have. And we are staying hyper focused on this for the next few weeks, just because there's obviously a significant increase in demand on telehealth. And it's very clear to us that many practices still have a lot of questions around telehealth services, and it's really hard to decipher a lot of the marketing lingo that you see out there and flyers and things like that to be able to really identify which solution may be a good fit for you. Again, as an example, how Office 365 is fully capable of supporting a telehealth initiative, while most practices don't realize it, it's just really due to the fact that some IT providers have limited knowledge of the space in terms of how to leverage existing tools within a healthcare arena. We also have some upcoming webinars. As you can see, on April 17th, we have one coming around the ins and outs of cybersecurity insurance, and another one on May the 15th around weighing in security requirements versus business needs. So those are also areas that we're going to continue to put out some educational material and help some of our clients and some of the other folks that are out there in the healthcare industry. Again, feel free to contact us. We have a hotline that's dedicated to telehealth. If you have any questions or immediate concerns, I'm going to go ahead and turn it over to Sierra to see if we have any questions in the chat rooms, and I can work with Casey so that we can address them. Sierra?
All right, thank you guys. So the first question I'm seeing here is, what are some tips on keeping patient wait times down?
So for the wait times, it's obviously very important to define the scope of the services that you're offering to your patients. For medical practice, one of the examples that Casey has highlighted that we showed earlier, I'll go back to that screen. As an example here on the top left-hand side, we have 4 different examples. You can see that there's a time frame for each one. First time patient visit, for example, for a common illness, that's just as an example again. It says 30 minutes. The one below it is another 30 minutes, but then on the right-hand side, you have a well-check visit that's 45 minutes. So by defining those boundaries and really just made it very clear that as the patients come in, they understand that there's a time limit on this visit, and it's, let's say, 45 minutes. And then you can ensure that that meeting or that call finishes on time so that you have enough time to prepare for the next one. And generally speaking, there's a buffer period that you can enable, as Casey mentioned earlier, whether it's a 15-minute buffer or 5-minute buffer that allows you to prepare for your next patient or your next visit. But ultimately, sticking to the time frame that you allocate for each type of visit and making sure that the patients do understand that, which generally speaking, they will have that as part of their calendar or within their invite, will help you keep those wait times low. The other thing you have to note is that it will only allow the patient to schedule a visit during an open slot, meaning that if I have 5 patients scheduled, they will not overlap. Of course, there's a risk that you may have a no-show, and there is that risk. However, we want to make sure that we are booking appointments where we can, where there is availability of the provider, so that he or she are not double booked, and that will ensure that you reduce your wait time or eliminate the wait time. Sierra?
All right, the next one is, how will I know if the Office 365 bookings will integrate with my EHR?
So that's a great question. That really depends on the type of integration that you're looking for. Some of the integration requests that we get are general patient demographics, where all you need is general patient information. And there's some components to that, and there's definitely an opportunity for some practice to integrate that. The one thing, though, I will say is that when it comes to the EMR, our recommendation is for the physician or the clinical staff to actually have their EMR open on a separate screen and follow their standard process to document that visit or that examination. In that way, we're not really taking the risk of trying to make the Microsoft platform become an EMR, because ultimately it will be a failure. So we always suggest that only basic information is captured within the Office 365, and anything that relates to the clinical side, there's no reason why the clinical staff can't have their EMR open on a second screen or minimized, and then when they start to document, they just open it back up and then type in the notes.
Awesome. Okay, and then the last question we have here is, somebody said they have Office 365 and they see we're using Teams for the webinar. What are our thoughts on using Teams for a quick solution for behavioral health? We do med checks, therapy, etc. And then they also said, I should have waited a slide because I see Teams is on your list, but I figured you could still kind of elaborate that on that, Reda, for them.
Yes, absolutely. So the good news is when we talk about this booking platform, it is actually the first step to using Teams. So it is, in fact, at the end of the day, the telehealth component itself is leveraging Microsoft Teams as means to communicate via audio video. However, the only thing that we're doing with this front component is allowing for some patient self-service. Just like what Casey showcased earlier, you can set it up where you can have a link on your website or a QR code that somebody using their mobile device or their iPad or their laptop, they click on it, and then they go to this website or landing page to actually schedule the appointment. Now, one of the things we get requested is, can we integrate the schedules that we have in the EMR with this? Well, the answer is yes. There's an opportunity to integrate it where you're creating these telehealth blocks on the EMR schedule, and then Office 365 will highlight that in the provider schedule, and that would translate into available slots for a patient to choose from. So if you're looking to use this for mental health services, your option is to either turn on this self-service component where they can schedule it, or if you simply want to go straight to Teams where you're sending an invite to the patient, simply open up your calendar or open up your Microsoft Teams and then select new meeting. And then of course, you will be required to have your patient's email address. And then once you populate that and you click send, the patient will receive the link, and obviously it's going to be in a scheduled in the future. And then they will also have the calendar appointment so that way they can integrate it with their personal Outlook calendar or Gmail calendar, whatever calendar they use. That way it is scheduled with the link inside of that appointment. Once they click on it, they will be able to go into a waiting room, and then from the clinical side of things, you'll be able to allow them to come into the room and then begin the session.
Awesome. All right. Well, that is it for the questions we have currently. If you do have any further questions that you think of or things come up, please feel free to email them to info@biztechnologysolutions.com, and we can absolutely answer those for you. Thank you guys, and have a great rest of your day.
Thanks, everybody.